Well, we'll go ahead and get started. In the interest of time, there'll be a lot of people joining us, I hope. We've got 50 or 60, so thank you all. For those that I haven't met or may not know me, my name is Steve Petty. I'm the president and CEO of the Lynn Institute. Thank you for being with us today. We've got a great program. In the interest of time, rather than doing introductions, I would ask that if you would please, in the chat, put your name and organization, and if you want to put your contact information, we'd be happy to have that. You'll also use the chat, please, for any questions or announcements that you have, because we want to give our panelists as much time as possible to go over this very important topic. So if you guys would remember to do that for us, we would appreciate it. And I again, thank you. And I think you're going to really enjoy what we have lined up today. You know, during COVID, the recent storms that I'm so happy that we've got warm weather, like we were saying, but there's especially the homeless were incredibly affected. Families and unfortunately lots of children experiencing this situation, especially over the last year with everything that has happened. We already had a fairly significant homeless population, but with COVID, the economy, it's unfortunately been a struggle for our fellow Oklahomans. But we've got a great panel that is going to talk a little bit about that. I would first like to introduce Susan Agel. She's the president and CEO of Positive Tomorrows, and she's also an executive member of the Count Me In for Kids Committee. Also like to welcome a new CEO for the Regional Food Bank, which is Stacy Dkystra. Stacy, thank you for being with us. And then everybody knows Dan Straughan, the Executive Director of the Homeless Alliance. I actually just met Dan again today. We met many years ago. So he, for some reason, didn't remember me, which is sad, Dan. We'll talk about that later. Anyway, I will have each of our folks talk just a few minutes about what their organization does, and then we're going to turn it over to Janine to ask questions. And then we'll also, like I said, being in the chat, we'll be looking for questions that we might want to answer. So first of all, I'm going to turn it over to Miss Susan Agel. She'll tell us a little bit about Positive Tomorrows. Susan.
Okay. Yeah. Thank you, Steve. So Positive Tomorrows is, we're a nonprofit that serves homeless families, and particularly the children. Our main program, and the one we've had the longest, is that of a private school, which currently is serving with our new early Head Start class children birth up through 6th grade, with intentions at some point in time in the future to go up even to 8th grade. So we're working with kids who are living in the shelters. Their parent may be in a transitional program like Remerge or in addiction rehab or something. And then we also work with a number of children whose families are couch homeless, and they're just bouncing around from place to place, trying as hard as they can to stay off the street. And it's our goal to work with the children, get them up to speed academically and socially. They've missed so much. They've often missed a lot of school, and we want to get them where they ought to be, and instill in them a love of school and a desire to come to school. And at the same time, we're working with the parents, and we're helping them identify what their goals are. Are they in housing? Do they need housing? Do they income, employment skills? Do they need a GED? It's just whatever it is that they need, addiction, rehab, all of that stuff. Make the referrals and help these families step through that one step at a time. And then when the family is stable and doing well, they're paying bills, they've been doing that for a while, 6 months and even longer, and the kids are doing well in school, then we'll help transition the children back into public school. And we really want that family to be a contributing member of society, just like everybody else. And that's our goal as we work with our families.
Great. Thank you, Susan. For those of you that just joined us, if you would, in the chat, that's where you'll be able to ask questions of our panelists that we're going to be listening to here in just a minute. But also, please put in your contact information, your name, your organization, if you'd like to put your email address. We're not going to do formal introductions. So, but I would like to introduce Miss Stacy Dkystra. She is the new CEO of the Regional Food Bank of Oklahoma. Stacy, can you tell us a little bit about what you all have been doing during this really rough time for all of us?
You bet. Thank you so much for inviting us. We're all, I know, thrilled to be here and appreciate everything that everyone on this call is doing. So thank you so much. And in terms of the Regional Food Bank of Oklahoma, as you know, food and nutrition are very fundamental to all of our health and the well-being of not only individuals, but our communities. And so we had to pivot fast and furiously back in March when this happened to figure out how you can safely make sure people are still getting access to food as they need it. And so, of course, in the way that the Regional Food Bank does, they are so innovative, and I'm so honored to be part of that group now. They created a drive-through model, so similar to Chick-fil-A. I mean, because they pretty much figured it out, right? I mean, they're kind of the best at that. But we kind of modeled that same thing, and different ones of our over 300 partners who actually do this kind of support found ways to communicate with people ahead of time, kind of find out what the foods are that they needed, get them packed up in boxes and get them loaded into their cars in masks where no one really had to touch one another, and still trying to, preserve dignity and meet the needs of folks. So it has been an exciting time, to be honest with you. I know my folks, they're so committed, but I mean, they're tired. I mean, this is a grind for sure. And it was, I don't know, Dan, you can help me, maybe 14 days into my new role at the end of October, when Dan calls, and we've got the ice storm. He's out of power, and he's got 200 people there he's trying to care for, and they just needed food. And so we have over 1,000 partners in our 53 county service area, which is about 48,000 square miles. But it's in addition to those partnerships, right? I mean, it's that Dan can pick up the phone and call and say, I need to feed an extra 200 people tonight. Is there any way you can help? And that that's what we do for our trusted partners, and he would do the same for us in any situation. And so we're just honored to be part of that. So not only do we partner day in and day out to make sure that the folks that he's seeing on the front lines are well cared for, but we also are there when crisis occurs and that looks bigger. So in terms of that, just a little bit more, just so you know, kind of the impact of the Regional Food Bank of Oklahoma, because this was so amazing to me coming on as the new CEO. I just wanted to share with you. In 2020 alone, we provided over 14 million pounds of produce to people in those 53 counties. And, we're really focused right now on nutrition and trying to do work with our partners to provide healthier options for people. And that's not always as easy as it sounds. Again, found out being new to this job, but over 58 million pounds of food in total was distributed in 2020. That was our biggest year ever. And probably because of COVID a lot. We believe the food gap in our state to be 61 million pounds a year. If we are distributing that much food, that if it was distributed perfectly, it would probably take care of the people who are facing food insecurity. But of course, that's a whole nother thing that we're continuing to work on too, because some counties get more pounds per person than others. And so we're working to distribute more equitably as well. Also, over almost 37,000 children were fed last year through the work that we do. And over 448,000 miles were driven with our fleet of trucks to get food out to those 53 counties and to all of our wonderful partners that are working directly with families. And, just a reminder, most of the people we serve are hardworking Oklahomans. Or they are seniors on fixed incomes that all of a sudden have found themselves trying to decide between a medicine and paying an electric bill or putting food on their table. So these are all our neighbors and our friends who, some of them we see once or twice because they lose a job or fall on hard times. And others, it's people who just need that little bit of food, that 3 or 4 days worth of food each month to make ends meet. So I'll stop there, but again, thank you for letting us be here and for all of you who help make this work possible.
Great. Thank you, Stacy. And we're
Mhm.
so glad you're with the food bank. We appreciate the partnership that Lynn has. And I know a lot of people on this Zoom also are great partners with you guys as well. So last but not least, the lovely and talented Mr. Dan Straughan, the Executive Director of the Homeless Alliance. Dan?
Yeah, thank you, Steve, and thank you all for letting us come talk to you. This is kind of a treat for me because there are names and faces that I haven't seen since my Success by 6 days, and that was 17 years ago. It's hard to believe, but it's good to see everybody, and of course to be on a panel with Dr. Dkystra and with Susan is an honor for me. So I'm the exec and the founder of the Homeless Alliance here in Oklahoma City. We do a lot of different things beyond calling Stacy in a panic and asking for food. We operate a campus for homeless services that has Oklahoma City's only day shelter for people experiencing homelessness. And pre-pandemic, we were seeing about 350 people a day in the day shelters, almost 7,000 in 2019 unduplicated clients. We operate a resource center on that campus in a little apartment complex. We have short and long-term housing programs for various subpopulations of the homeless, for chronically homeless individuals, for homeless veterans, for transition age youth, for people re-entering society after jail or prison, for people who are fleeing domestic violence, and for families with children. We operate on the campus. We have professional staff, physicians, pharmacists, social workers, substance use people, mental health people, employment training and placement people from 24 different government, faith-based, and nonprofit organizations, all co-located on this one campus. We also operate another multi-agency resource center up on 3910, and that serves the LGBTQ community in Oklahoma City, and our part of that is to do housing for people who are HIV positive. And then, surprisingly, I have become a magazine publisher. Curbside Chronicle, Oklahoma's only street news magazine, is a program of the Homeless Alliance, and also a snow cone magnate. We have a program called Sasquatch Shaved Ice. We have 2 permanent snow cone stands and a mobile snow cone stand, and we use that to employ transition age youth who have some involvement with either the foster care system or the juvenile justice system, or both. And obviously, those employment programs are, well, it provides an income, but we're also providing a lot of case management and other supportive services to get those young people set for adulthood. Oh, and Curbside Flowers. We have a flower shop now. So I think we have like 6 locations. And I very clearly remember starting the agency with 1 employee and a visionary board. So we've grown a lot over the years.
That's great. Thank you, Dan. It's amazing, all of the different venues and things that you're doing to help. So that's great. So for those of you that just joining us, if you wouldn't mind, put your contact information in the chat, and also any questions that you have for the panel, please do that as well. I'm getting ready to turn it over to Janine Pointer. Our Chief Strategy Officer is going to ask the panelists some very hard-hitting questions. I hope you guys are all ready. It's going to be like Jeopardy, so let's go. All right. Thank you all for being here. We appreciate it.
Thanks, Steve. And thank you 3 for being on with us today. We're going to start with some questions that I would just like for all of you to weigh in on. They're short, rapid fire kinds of questions, but these came from some of our members wanting to know your opinions and thoughts. Before COVID, had we begun to see an increase in the homeless population or a decrease? And do you think that the increase, if there is one, occurred with COVID? And what do you see happening once things open up more and people can go back to employment, that kind of thing? And how will that have an impact on the homeless population? Dan, we'll start with you.
Yeah, so before COVID, we had been on a 10-year trend of a slow decrease in the number of homeless in Oklahoma City, with the exception of the year immediately prior to the pandemic. So 2019, we had a small increase, and 2020, a slightly larger increase. The pandemic has limited our ability to do the research to determine what our numbers are right now. But anecdotally, that we've seen a fairly significant increase, especially in unsheltered homeless, largely because our 8 homeless shelters in Oklahoma City all had to reduce capacity during the pandemic in order to enable social distancing. And I'm going to preempt Susan because I know she's going to bring this up. And all the numbers I'm talking about are what we call literally homeless. So that means you're living in a homeless shelter or in a place not meant for human habitation, like a car or under a bridge or something like that.
Okay.
It does not include couch homeless, and that number is anywhere from 7 to 10 times bigger than our literally homeless population. And it's next to impossible to count because, I mean, you can drive down any street in your town and there may be a couch homeless family living with a distant relative or a friend from church or somebody from work, and you would never know that. So it's a population that is much larger than our literal homeless population and much harder to enumerate.
So Susan,
I get to talk
just
now.
tag on to that.
The conversation that Dan and I have about all of this is that when you count just those who are literally in homeless, you skew against the numbers of families. Families don't really hang out on the street corner. They don't, I mean, they're worried about the kids. So they hide away. They're more difficult to find. The other issue is that the shelters, that their family units are always full. So if a family wanted to go to a shelter, they can't because it's really difficult to get in. So that's part. I think our numbers of homeless families are skewed just because of the way things are.
Mm-hmm.
And to sort of exacerbate that issue, many of the housing programs that HUD has are limited to people who are literally homeless or have an eviction notice. And so a couch homeless family literally would not qualify for half of the housing programs that we have.
Okay.
And that's one of the things that we see. And there's also national research that says that families with children are 3.5 times more likely to be evicted than households without children. Children do stuff, they tear things up, they run around and make noise, that sort of thing. Well, the numbers that we look at a lot are the numbers of homeless children that the schools report at enrollment.
Mm-hmm.
And that does capture a lot of the couch homeless children. That number has, I see Kathy Brown's here. Hi, Kathy. Kathy tells us Oklahoma City Public Schools is now reporting about, for last school year, they identified about 2,500 homeless children. That number has dropped a little bit over the years. And unfortunately, Putnam City seems to make up for it. Putnam City schools are reported last year about 3,400 homeless children in the Putnam City schools. And when you look at Putnam City Schools with reporting 3,400 homeless children and a total enrollment of 19,000 students, that's 18% of their enrollment in the Putnam City School District is
Wow.
that school district is counting as homeless. So, I mean, that's there's a lot of families doubled up in some of those apartments along 10th Street and some of the other areas there in that area. So anyway, those are the kinds of things that we look at. And really, if you take it as a whole, just with those two school districts, it's really remained about the same over the last several years.
Stacy, do you have anything to add to that?
You know, I really don't. They did a great job, except for to say what we're really concerned about is as people start getting evicted from their current situations. We've about a third of the people we're seeing in our partner pantries are new to food insecurity, and so we just feel like that's a trend that's gonna just keep, I don't know, getting, more difficult and more difficult, even as we come out of COVID-19, and it's a real concern for us.
Okay. I'm just going to go straight into a question for you.
Okay.
We know that you get food in the hands of a lot of our agencies and partners, but are there ways that you are getting it straight to the homeless population? Do you go into the homeless camps or do you have satellites out where there's congregate people from the homeless population? How does that happen?
I appreciate that question, and I'll tell you from my perspective, I learned a long time ago that in the field of nonprofit, the more we can partner and lean on our experts in each area, the better. So it has never occurred to us to do that because that's Dan's lane and he does it so very, very well. So what we see our role is as support for him. Anything he needs. If he came to us and said, we're going out there to visit with folks and we want some of your backpacks for kids to take with you, we would do that, right? So we see ourselves as a supporting role and not a direct service. The only real direct service that the Regional Food Bank of Oklahoma does is we do keep food always right inside our glass doors that anyone can come and pick up we don't even talk to you, we don't ask your name or any information. But so, I mean, and it's not an easily accessible place, but it is a place where anyone can come, and we leave the doors open at night so you can come and pick up that food if you need it. So, but as far as that goes, we really depend on partners.
Awesome.
I will echo that. When the pandemic hit, the shelters reduced capacity, and we saw kind of an explosion of unsheltered homelessness. Working with our partners, we, the community, roughly quintupled the number of outreach workers we had as a community. And we equipped all those outreach workers with information about the virus, what the symptoms were, hand hygiene, masks, all that kind of stuff, and food, because one of the things we didn't want to happen was people leave their camps and go to a large congregate feeding site to get food. And I'm going to say we were out every day, 7 days a week, 12 hours a day with teams and teams doing street outreach. And 95% of what was in those bags, including the hygiene items, came to us from the food bank.
Okay. Dan, I'm going to go ahead with you.
Janine, one
yes.
question. There was a couple on the chat I want to make sure that we get. Karen had asked, are the homeless getting access to COVID vaccines? And then another question is, what is the address families can go to pick up food boxes? So I'll throw that out there. Sorry to interrupt.
That's okay. And I did put that address in the chat box.
Okay, thank you.
Got it there.
You bet.
3355 South Purdue.
Dan, we'll let you answer the question on COVID vaccine.
Sure. So it's a very timely question. We began yesterday vaccinating people experiencing homelessness. We started at City Rescue Mission. And for those that are in the shelters, we're pretty much using and when I say we, I'm really talking about Healing Hands. That started City Rescue Mission, and for the sheltered homeless, those that are in any of our 8 shelters, we are using the 2-dose Moderna vaccine. And what we're working on for unsheltered homeless, because I mean, you may see them today and then not again for a month. We're trying to get access to the Johnson & Johnson single-dose vaccine from the State Health Department.
Gotcha. Okay. Susan, here's a question that someone asked. What is the impact that you see homelessness has on children? The trauma, falling behind, all of the things that come with that. What are you seeing in the kids?
You know, one of the things that they tell us, I mean, the kids tell us, is that they're very lonely in the public school district, or, you know, because they're sort of by themselves, and loneliness is, I mean, they say that it's just me. And so that's one of the things that we see. And I think some of the, you know, they're just, the effects of trauma is that we've got children who are hyper reactive, and they're hypersensitive, and they're always waiting for things to go wrong because they always have. And so, you know, if somebody drops a book on the floor, to us it sounds like somebody dropped a book on the floor, but it's one of our kids, it could sound like a gunshot. And so the reaction is very visceral, it's very different. And I think that's why some of our schools have disciplinary issues. It's just not being able to understand that these kids they're always waiting for something to happen. So, I mean, it's that kind of thing. The other thing we see is just plain old lack of experience. There's so many things they don't get to do or try, or, you know, learn about themselves or about the world. We had a child here a couple of years ago who had never seen his parents buy anything. He'd never been in a retail store. He had never been in a private vehicle. He'd only ridden on public transportation. So that's a child who just, you know, he can't really compete in a classroom on any level because he just doesn't have any experience to bring to it. So, you know, it's things like swimming lessons. And that's one of the things we'll do, is that we try to introduce children to everything. Oklahoma City Ballet does outreach with us, and every week everybody takes ballet. They do music, and they do, you know, we try to introduce them to everything, because the one thing we want is for every child to find something they're really good at, because that moves you on. It helps you be successful in school and helps you move on from there. So it's just that lack of experience. It's the feeling that chaos is normal. It's we do see some children who are very small because of nutritional issues. The other thing we see is that children who need special education, but they never make it through the process in their school because they bounce around so much. It's an onerous process to get through the special ed, you know, to jump through all those hurdles. And if you don't stay in one place more than a few months at a time, you don't make it through. So that's the other issue that we work on. And I think one thing that we've been seeing recently, just this school year, and even in the last few months, and I don't know, I'm guessing that COVID is playing into this, but we're seeing a lot more neglect sorts of issues. We had a little girl who was sent to school yesterday with a broken bone in her hand. And, you know, so we got all that taken care of. We have other families that are just, a family right now that's dealing with a severe case of head lice. Took all day to comb through one of the girls' hair. And I mean, their scalp is raw from scratching. I mean, it's just, we're seeing that, and that's at a higher level than what we've seen before.
Mm-hmm.
So that's what I'm guessing, is that we're all just tired, and we're all just, you know, it's different right now for everybody.
So Dan, I'll jump to you on a couple of questions. What are the most prominent reasons that Oklahomans experience homelessness? And to that end, then, do we have enough shelters? Are families being able to stay together? You know, where do we find them? That kind of thing.
So the, the reason people become homeless in central Oklahoma is, I'm super simple. It's lack of affordable housing. In Oklahoma County, we have 135,000 people who live at or below the poverty line. And while we have one of the most affordable housing markets in the country, when developers are talking about affordable housing, they're talking about housing that is affordable to you if you're making 80 to 120% of area median income. So if you're making 40 to 60,000, we have a wonderful housing market for you. If you're on SSI or SSDI, or you have a minimum wage job or a $10 an hour job, you're nowhere close to that. And that is it. And truth of the matter is, if you ask a kindergartner, what is it that a homeless person really needs? It's a home. And so, I mean, that's what it's really about. People think a lot of times, it's severe mental illness or addiction disorders and those sort of things. Those are contributing factors, but you have to remind yourself there are way more people in Oklahoma City with a serious mental illness who are housed than there are who are homeless. Same thing with addiction. Way more people in Oklahoma City who have an addiction who are housed than are homeless. It's cost of housing versus level of poverty. That drives more than any other thing our homeless numbers in Oklahoma City. And to reinforce one of the things Susan said about how families have to bounce around, one of the things we do at the Homeless Alliance is we have Oklahoma City's homeless management information system. It's just this giant networked computer database that agencies serving the homeless use to share data on shared clients. And we've been doing that since 2005. And so we just have this mountain of data on the homeless population in Oklahoma City. And up until a couple of years ago, we never had the wherewithal to really dig into that data and do advanced analytics. And OCU had some of their students and a couple of their PhDs take that on as a project. And the thing that they found that more than anything else was a predictor of becoming homeless and length of time homeless was not mental illness. It was not substance use. It was the size of your social network. And if we asked that question, how many people could you depend on to help you out if you got into a problem? And the smaller that number got, the more likely you were to be homeless and to be homeless for long periods. And so for families with children, when they're bouncing around and they don't have a stable school environment, they don't have the opportunity to build the skill set that allows them to have that social network. And so it becomes a cycle.
We have a question in the chat. Is homelessness a criteria which would cause a child to be removed from the home and put into foster care?
Absolutely not.
No.
Okay.
Although that's a consistent fear that we hear from clients that are nervous about accessing services.
Mm-hmm.
Yeah.
I don't know if everybody saw this, but Sunday night on 60 Minutes, there was a story that ran that showed a great deal about homelessness. And it was a revelation to me, and I think some other people. Stacy, there was a food bank in Ohio that literally the person walked and it was full to brimming with food. And then there was a homeless young lady who was had 2 jobs and yet went back to a tent every night to sleep. And she was expecting a child and didn't know what she was going to do. And the reason I bring up Stacy, the warehouse, is because the gentleman who was in your position said it would only take 1 day if things kept going the way they were for them to be without food. to even be able to give. And then I'm sure you all see, Susan, I'm sure you see some of that as well. So I just wanted to give you all an opportunity, if you did see that story and you see those scenarios, to comment on that. Susan, you can go first.
We do. We have a lot of families that there's somebody working in the family. They just don't earn enough to keep things going. And then you, at the same time, you have to, there's other barriers to obtaining housing. It's if you've been evicted before, or if you have utility bills that need to be paid, or, I mean, there's other things that can get in the way. And you have to save up enough money for the deposit and the first month's rent. You know, all that stuff gets in the way. And it can be really tough. And yeah, we do see situations like that. Right before everything got so cold here a few weeks ago, we had two families living in their cars. And so we were able to get them. One of them did find someone that they could go stay with, and we just put the other one up in a motel during that very cold weather. And I think actually they may still be there, but that's where they are.
Okay. Anybody, Dan or Stacy, do you guys want to comment on that at all?
You know, we opened this winter shelter at the old Willard Elementary School, and during the worst of the February freeze, we had a 24-year-old young woman come in with a 1-year-old and a 7-week-old infant. And she had been dropped off at the Willard Winter Shelter, and I encourage you all to go down there. It's safe, warm, and dry, but it is not luxury accommodations. And the person who dropped her and that baby and the child off was her boss where she works. And I would love to meet that guy in Whoopies and have a discussion with him about how he really could have helped her. But same with Susan. I mean, the Willard Winter Shelter is not an appropriate placement for a mom with a 7-week-old. So we put her in a motel, and then we're able to get her into housing last week. But a lot of the people we see have minimum wage jobs or low wage jobs. And in Oklahoma City, it takes 2 adults working 2 full-time jobs, and you still can't quite afford a 2-bedroom fair market rent apartment.
Yeah.
Okay. So I'm going to pivot here for just a minute. And this is a group, Count Me In for Kids is committed to children, at-risk children and their families. And so these are all partners that are coming together to impact the issues that are impacting families. And so I would love to hear from each of you on what you believe a group of this size with these partnerships and what we can all come together to do to impact homelessness in our community, first of all. And then there has been a question about healthcare. And so I'd like for you guys to include some information about healthcare access for the homeless, just like Susan, your example about the little girl. Is there a lack of healthcare access, and how does that impact in preventing some of the things that happen? So that's a big, long question of what do we do to make this better?
Well, let me just say, just in terms of what do we do to make this better, is I think we just need to talk about it. We need to raise some hell now and then, I guess is the best way to say it, because we've got families that are really living in some very desperate situations. And so I think we need to, all of us as a group, I mean, we need to talk about it. We're always looking for landlords that we can have, that if we'll case manage families, will they rent to one of our families? That's one of the things we're always looking for. So if you know of anybody, let us know. Regarding the healthcare question, that's one of the things that we pay attention to regarding our children. We work closely with Variety Care, so we make sure that every child that we enroll gets a well child check and follow-up medical care if necessary. We make sure they all get dental care. We've seen kids with terrible dental problems, and I don't know how they could learn or do anything at school with their teeth in as bad a situation as what we see. So we take care of that. We make sure they get hearing screenings and eyes and taken care of, and glasses if they need them, and make sure they had vaccinations and all that. So we do take care of that for the children. And that's one of the things we try to do also with Variety Care, is help establish a medical home for the families that we're serving. It can be hard because they're not quite used to that, but our case managers do try to make sure that those things are cared for.
Dan, what about you?
So I'd say two things. One, advocate for more truly affordable housing in the community. We have Oklahoma City Housing Authority, which operates public housing and also does what we used to call Section 8 vouchers, now Housing Choice vouchers. The Housing Authority has the same number of public housing units and Section 8 vouchers as they had in 1978. Same number.
Wow.
So advocating for more supports for truly affordable housing is one of the really practical things you can do. And the other thing, and this is gonna sound kind of weird, but everybody on this Zoom belongs to one or more smaller communities. Maybe it's your neighborhood association or your church home or your Sunday school class or your alumni association. You all belong to some smaller community. And if everybody on this call and everybody who will ever listen to me would go to that community and make a covenant in that community, no matter what it takes, we're not going to let a member of our community become homeless. Whatever it takes, we're going to prevent that from happening. And if everybody in Oklahoma City would make that commitment in their little community, I'd be out of a job in 6 weeks, and I'd be really happy about it.
Stacy, do you have anything to add?
Well, I guess the optimism in us is hopeful that the Medicaid expansion will somehow contribute in a positive way to making sure our children do get, the care that they need. But I think that Susan brought up such a good point about the whole, you're sort of, there's some other barriers there that you face when you're trying to connect people to resources that aren't in our control. And so, trying to navigate that is really difficult as well. And luckily we have really great trained people who can do that. But I think that presents a challenge for sure. And I just appreciate what Dan said. And I think it's not only about homeless, but about everything, right? If we did what Dan said and we all made a covenant in our communities to just take care of one another, we would all be out of jobs. And I love what he said. And it's sort of flipping advocacy in a way to really just hone in. And, we do know all the research says if you let people solve their own problems, that's really, instead of trying to do to people, right, creating environments for people to help solve their own problems, and doing what Dan said is exactly, it's creating that environment for people to work together to solve their own problems. So I'm going to do that, Dan.
Wonderful. Let's talk about a little bit about, Dan, I think you alluded to it, how many people are living below the poverty line and how many people are just barely above it. And so question for you, for this size of a community, Oklahoma City, in population, do we have the same about percentages of homelessness as another community our size? Is it less, more? And what do we, what does that tell us that we need to launch from that point?
So it gets kind of really hard to compare. Given the level of poverty in our community, we actually have a little less homelessness than other cities with our level of poverty, but we have a really high level of poverty in percentage terms. And so we have a fair number of people experiencing homelessness.
When you all talk about housing, you know, there's been a move even in our community about tiny houses, some of that, some other types of rehab that's being done in homes in specific neighborhoods. What do you say to that? And is that one of the solutions?
So one of the great things about working in this field is the unmet need is so great that you really can't screw it up too much. So tiny homes is probably not the first thing that I would build, but every tiny home that gets built is housing somebody, and that's a good thing. So my sense is you can build like a little apartment complex, SRO type, single room occupancy type housing for a little cheaper than tiny homes. But I mean, you give up what you always give up in multifamily housing. So I know there are some tiny home communities in other cities. Austin has a really big one that's very successful. Some other cities, youth services of Oklahoma County, how old am I? Pivot is building a little tiny home community on their property up on 50th near Santa Fe. And I think that's really successful. So yeah, tiny homes are a good thing.
They work well for singles or couples, but you know, families, that's not a good option. And I think sometimes when we even look at housing, affordable housing, we forget things like playgrounds and those sorts of things. That's a necessity for a child to grow up appropriately. And so that's the kind of thing that I'd like to see.
I'm going to make a last call for questions, but I want to give each one of you a last opportunity. I'm going to start with Stacy because you have a captive audience, and I asked questions from our members, but I may not have asked the question that you wished I would have asked. So I'm going to give you an opportunity to say or to answer a question that you wish would have been asked, or something you really want to leave this group with. And if you'll just take about 2 or 3 minutes each.
I think sort of to build on something Dan was talking about, and our poverty rate is very scary. And what's more scary to me is the people that sit right above it, because we have a very large population of people that sit right above that level. And those are the people that are living in this really insecure type of situation, because they're just anything from losing, the place that they live, or not being able to put food on the table, or losing their job. And I think we sometimes sort of forget about that group, you know what I mean? But that makes all of our jobs harder when we do. And so just remembering that that there are lots of things that the community can do, starting with what Dan said, but just kind of taking care of, your own neighborhoods and things like that. But also really thinking about, paying people a little bit more money at that minimum wage, because like Dan said, when 2 people could be working full-time or multiple jobs, and, that's what we see so much of as people come to get food because something unfortunate has happened. It may be with their health, their car may have broken down, but for whatever reason, they can't do that. And the whole point of me saying this is that is so unhealthy. I mean, we just think, it's, yes, they don't have a place to live. Yes, they don't have food, but the experience day in and day out of that insecurity and falling in and out of that situation is so unhealthy and creates lots of chronic health conditions that as a community we all suffer from. And I think just leaving us with that message that this is us. It's not them, right? It's not them, and it's us. We're all in this together, and we just need to work together and be clever and innovative to figure out how to meet needs and lift people up.
Thank you.
Mm-hmm.
Susan, why don't we go to you?
Yeah. First of all, we really like to partner with people. So if there's anyone who sees an opportunity to partner, just please reach out. Let's do that. We really are like to be creative about some of those kinds of things. The other thing that I want to say is I think we can all work together to help our community to understand that being poor is not being bad. There's a great tendency to equate homelessness with people who have something wrong with them, or they're I've heard it equated to dirty people, and that they're not dirty people. They're maybe people who don't have access to a shower or a place to put their trash, or all of those kinds of things. So I mean, and we see that play out in the kids that we're serving. Last year at the beginning of the school year, our 5th grade teacher was sitting at the table with some of her students in her classroom at lunch. They were having lunch, and one of the boys spoke up and he said, "At my old school, I was the bad kid." And then around that table in that little classroom, several other kids spoke up. "I was too. I was the bad kid at my school." So, I mean, and none of these kids were bad kids. So it's just, we assign things to people based on stuff that doesn't really matter. And so I think we can all work together to deal with that. And then the other thing I would say is that I don't, particularly with the kids that we're working with at Positive Tomorrows, is that this isn't a hopeless situation. Research tells us that children that grow up in deep poverty, they actually, there are problems with the way their brains develop. They don't develop those, just there's cortisol flooding their system all the time, and the pathways that develop in your brain for logical thought and putting things in sequential order and all that kind of stuff that's important to learning don't really develop well. But you can, research also tells us that you can develop those pathways. You can rebuild them by doing things like art and music and all of that stuff. And so, I mean, we're not in a hopeless spot. And so we'll all keep plugging on that day by day.
Thank you. Dan, one last question, and then I'll let you share. Will you be rescheduling the point in time count for later in the year? And then I'd love for you to share some last words.
Sure. So rescheduling the point in time count is an item under discussion. And everything really depends on where we are with the pandemic this, July, maybe August. We really want to. It's good data. We use it every day, and it hurt not to do it this year, but we gotta find a way that we can do it safely.
Anything you want to add?
I guess one of the things, sort of building on what Susan was saying, in the work that you all do, Dr. Dkystra and my work at Success by 6 kind of hammered into my head that the way the highest return on a charitable dollar is when you put it on that 0 to 6. When I started the Homeless Alliance in 2004, our point in time number was about 2,500, and honest to God, I thought, well, I'll knock this out in a couple or 3 years. 2,500, that's not very many people. And then I can go back to the bank or go find something else to do. And what I've discovered is, it's a complex issue, and you got to be in it for the long haul. And where the long haul starts is with the kids. We can do a lot to help the parents and the veterans and the chronically homeless, and we have to. But we have to really put more of a focus as a community on families with children. And the work work you all are all doing is unbelievably important.
Well, thank you to all three of you for being with us and having this discussion today. It's been very insightful and motivating, and will, I think, spearhead some future talk and with this group. So I'm going to turn it over to Deirdre McCool, and she's going to close us out for today, and we'll go from there. So Deirdre.
Yeah,
Please.
and I just want to echo what Janine says. I learned a great deal today, and I want to thank you, Dan, Susan, and Stacy, for providing this desperately needed services to a really marginalized population. And I feel like in the conversation today, a quote by Helen Keller really captures the essence of the importance of these partnerships in Oklahoma. And that quote is, "Alone we can do so little, but together we can do so much." And so we just want to appreciate we want to express our appreciation for all of our Count Me In for Kids partners, and just excited about what the future holds for Oklahomans as we work together. Thanks for everyone.
You guys go and have a good day, and let's remember what we heard today, and let's come back together with some talk and plans and inspiration to make a difference in Oklahoma. Thank you.
Thanks, everyone. Have a great week.
Thank you
Appreciate
all.
your time.